Just as millions of Californians get ready for holiday gatherings and travels, COVID-19 cases are ticking back up across the state. It has many medical experts fearing another winter surge. For more on the topic, joined now by Dr. Karin Shavelson, a pediatrician and the chief medical officer with MarinHealth. Doctor, thank you so much for joining us here. Obviously, kids are now able to get vaccinated, that 5 to 11 age group. I want to start by asking, if family members are fully vaccinated against COVID already, should they worry about possibly getting sick over the holiday season?
I think everybody should be worried about getting sick. There are a lot of viruses out there, not just COVID. So anybody who is eligible for the COVID vaccine should absolutely receive it. That will make your holidays much safer. Don't forget, though, there's influenza as well. So make sure you get your flu shot also. That's really important this year. I think the biggest thing is if you're sick or you have a known exposure to any sort of virus, COVID, influenza, or somebody who's had a fever, a cough, the usual viral symptoms, you want to stay home until you can talk to your doctor and get tested. It's a tough time of year to stay home again. We went through that last year, all of us, and I know everyone is really eager to get together with their families. But if you don't feel well, or you know you've been around somebody, certainly somebody who had COVID, even if you're vaccinated, stay home, get tested, talk to your doctor.
I know that the state officials gathered today. They were encouraging people to get booster shots, but not everyone is eligible for a booster. Should those who are not eligible right now be worried about not being able to get a third dose?
No, we don't think so. We think the first two shots that you had should be more than adequate. Most of you have really healthy immune systems, which is why you aren't necessarily qualifying for that booster shot or a third shot, which is the shot based on medical conditions. So you should be just fine. We know breakthrough infections do happen. The good news is you don't get very sick and you're unlikely to end up in the hospital. But again, if you don't feel well, don't take any chances. Get tested.
What is it about this winter season that makes it so concerning for potential uptick in COVID cases?
Well, unfortunately, we probably don't have herd immunity quite yet, even in the Bay Area where we've done so well. We're seeing an uptick in cases in Southern California and to the east of the Bay Area. We know that Delta variant is very, very virulent. We know it's very powerful. And so it's really important to recognize that over the holidays, when you're mingling with your relatives, most of whom probably aren't in the Bay Area or some who aren't from the Bay Area, they may have been around more unvaccinated people than we're used to seeing in the Bay Area. So all of the traveling and mingling and unmasking and cold weather bringing us indoors, it's a little bit of a recipe for an increase in COVID cases. I know our public health officials and physicians and others in the healthcare field are a little bit concerned about these holidays in particular. The good news is, as you mentioned, with pediatric vaccinations being possible, in that second dose coming in before the December holidays roll around, that'll help a lot. So absolutely, if you have kids who are of age or eligibility to get vaccinated, do so right away. That way they can get their second shot in time for the December celebrations, and you'll have a little bit more peace of mind.
If kids haven't gotten their flu shots and they're getting ready to get their COVID vaccine, can they get them both at the same time, or would you suggest that maybe they wait about a week in between getting the flu and COVID shots?
I would advocate for doing it at the same time. No kiddo wants to go back to their pediatrician, even one as quick at giving shots as myself. They don't want to go back twice. The joke I tell about a friend's daughter is she wanted a picture of herself getting the COVID shot, but she was afraid she might cry. And so she wanted to get the flu shot at the same time, and she also would only let her mom take a picture of her from behind so that she wasn't crying in the picture. So just get it over with, get both.
I know that Governor Newsom, he spoke about getting both his flu shot and his COVID booster. He said that he felt worse from his flu shot than his COVID booster, which is not something I have heard. I know that both kind of give you that sore arm, but in terms of having a reaction from a flu shot versus a COVID shot, I tend to hear more people having reactions from the COVID shot. So what have you been hearing in terms of side effects from flu shots?
You just like the COVID vaccine, you might feel a little something from the flu shot, and some people get sicker than others. Remember, this is good. I don't see it as a bad thing. When I feel a little bit cruddy after any vaccine, I think, oh, great, my body knows what it's supposed to be doing. My immune system has identified the enemy, and it's out there doing what it's meant to do. So it's not much fun. I get that. But I promise you, the little bit of side effect we get for a couple hours, half a day, or a day after these vaccines is nothing compared to the disease. And it's nothing compared to the potential it has for causing morbidity and mortality in the old, the young, the frail, the sick.
Dr. Karin, you mentioned that we are definitely not at herd immunity just yet. Where do we stand, and do you think the Bay Area will reach herd immunity?
I think the Bay Area could reach herd immunity, but the challenge we all have to just be honest about is the Bay Area isn't staying still. We want to travel, we want to go places, we want our relatives to visit. And so our herd immunity is really our country's herd immunity. It's the nation's herd immunity. It's the world's. If we're all wanting to travel and go different places and see different people, we have to accept that mingling comes at a bit of a cost, unfortunately. And so I think the best thing we in the Bay Area can do is serve as a model for a region that has phenomenal vaccination rates. But even within our region, we have opportunity for improvement. I live in Sonoma County, for example, and the vaccine rates in Sonoma County don't approach those of some of the Bay Area counties, including Marin, where I work, which is doing amazingly well, but they're neighboring counties. So we need to be mindful that our neighbors need to be as vaccinated as we are.
All right, Dr. Karin, thank you for joining us and giving us a little bit of insight as we head into this winter season. Appreciate your time.
Great. Thank you so much.